Thank you all. Today my talk is about physicians' rights. But why did I started with patients' rights? Because usually when governments address health sector reform, they address it from the standpoints of patients' rights. However, in Egypt, physicians think that it's physicians' rights that are mandatory as a first step if you want to address really patients' rights. Why do they have this belief? I will start with the videos here. Okay. It will take some time. Okay, here it's rolling.
Dr. Mahmoud Abdel Fattah lies stiffly in his green scrubs on a bed in the inpatient unit at Bulaq of Lakour Public Hospital, a doctor-turned-patient in his own hospital. But more troubling is how he ended up there.
He asked for painkillers to respond. I told him hospital was intended for 5 months. He grabbed me and now used to become married to something that was strike. He told that I accused my mother beat me before my clothes. His family including 6 brothers.
Unfortunately, Dr. Abdel Fattah's case is all too common these days in Egypt, where public hospital doctors bear the brunt of a corrupt healthcare system's failures. Frustrated patients and relatives, unable to receive the services they need, or forced to supply costly or rare medicine themselves, are increasingly taking a rage out on doctors and staff. Like other public hospitals, instead of increasing security, Bulaq of Lakour has closed the emergency room indefinitely since the attack. The empty beds lay bare to the cracks, both literal and figurative, in Egypt's ailing public healthcare system. Bloodstained sheets, peeling paint, garbage, stray cats, and roaches are common sights.
We have been crouching garbage, five speakers, equipment, and electrical wires. Last month, a baby died because an installation was not available.
For the third time since the January 2011 revolution, doctors are striking for an increase in healthcare funding from its current 4.7% to a worldwide standard of 15%. So far, the health ministry has made no concessions, despite escalations and protest actions, like the threat of mass resignation. On November 1st, a huge chain of healthcare professionals and political activists, followed by a march from the doctors syndicate to the health ministry in Parliament downtown, was met only by riot police.
No one said to us, no one said us. They are dealing with us the same like the old era. We feel that Hosni Mubarak is still on the top of Egypt with still Aliaa Elsheikh and all the people we have. We feel that they are still here and they are dealing with us the same way, no change.
A week later, the protesters marched in a mock funeral procession for Egypt's health ministry in another attempt to resuscitate the town healthcare effort. Doctors say that instead of investing in prevention, terms of negotiations might not be treating the symptoms or ignoring Egypt's pains entirely. They believe there's an ulterior motive. Most health industry officials are the same ones from former President Mubarak's era of corruption. These officials would work for better private hospitals, and it benefits them to maintain the poor status quo of public hospitals.
You find a place for us to have the treatment. So at the same day, you can go to another hospital, still in Egypt, but it's not public, okay? And you'll find everything in the chain. You'll find rats, cats, any kind of animals inside the public hospital. On the other hand, you'll find this special hospital, very clean, but it's very expensive.
The health ministry denies these accusations and says they're trying to compromise with doctors. But while the ministry may be trying to meet doctors halfway, it still has a long way to go in serving its patients. Reporting from Cairo, I'm Aliaa Elsheikh.
Any questions? Okay, so what are I'm going just to highlight some of the important problems that were raised by the video. It's actually what the physicians are pointing out. There's violence and lack of safety. It increased after the revolution, but it's a common story to work in a public hospital and get beaten up because you didn't save the patient, because sometimes they come in a very bad situation. I was lucky enough I was never beaten. Poor working conditions and lack of resources, the frustrated patients, the poor salaries, poor health budget, which they pointed out it's 4.7. I want to increase to 15%. self-interest of officials who work in the private sector, and they don't want the public sector to improve. The question is the government really ignoring the situation? Was nothing ever done to address this situation, which started earlier in the 1990s? Where actually the government narrative is that in 1990s there was a global movement worldwide led by the major donor aid foundations to address health sector reform in developed and developing countries. And this was because there were a lot of malaria control program, TB control program, maternity, child and health. And these programs were all like draining money with no sustainability because the healthcare systems were so weak that they cannot just continue to roll without the donor aid. And so there were great interest to reform the health systems in these countries, among which was Egypt, which undertook the health sector reform project starting in 1995. And as any reform project starts, it starts by analyzing the situation to understand where are the problems. So they started with the worst part was assessment of the financial performance. So when they are talking about, the physicians are talking about the budget of 4.7%, actually it's not all coming from the government. It's only amounting like less than 50% comes from the government, as you can see, with a less from private, even employer funds. The Ministry of Finance is the main financer of the Ministry of Health. There is no revenue generation from all the hospitals run by the government, which cover 95% of the geographical area of Egypt. There is very high geographical coverage for the health services in Egypt in terms of infrastructure. However, and the rest, where the household funds amount to 62, or even sometimes they say this is an underestimate, the rest of the 4.7% of the budget is actually people's money, okay? So even that's, which points out that the public spending is really poor. Why do we have that situation? It's because after the 1952 revolution, military coup, whatever you want to call it, there was a communist political situation, and they were saying we will give free health for all. And it's obviously not sustainable. Where will you come up with the money for free for all? Who will pay for it? So what happened is the premiums and co-payments, for instance, for an organization like the Health Insurance Organization, which started in 1964, up till now, are the ones used up till the moment. There was no reform in the schedule. We're looking at that the GP visit, you pay 5 piastres, which means like 5 cents per visit. The maximum you will pay in the system is £1. This is not logic. This is not sustainable. It has never improved or was adjusted to the inflation rates, nothing. Okay? And when they analyzed the budgetary situation, financial situation of this organization, all of them were losing, except, as you can find, the last one, which is the school health insurance program. Actually, because this was done, was implemented in 1994, so the premiums were done at that year, adjusted to the economic situation then. However, later on, it started to lose money as well, because it was not, there was no correction for inflation in the formula used for these premiums. The other problem is you cannot use, like when you have revenues from one organization, you cannot just shift it to the other budgets. So even if you find a winning, someone generating revenue, that cannot cover the costs for the other organizations. So you are ending up with a very high number of infrastructure, but they are all not generating enough cost to cover their even expenses or even break even. The other thing that the 1952 Constitution did is to provide free health. There should be free higher education for all to make sure there are enough doctors. And what they will provide instead, or subsidized higher education, because we pay like a very minimal tuition fee, which is reached now after increasing to £300, which is almost $50 for tuition fees for a medical school, which is the most expensive education in the world. In return, we are supposed to serve for 2 years in the Ministry of Health, in the primary healthcare units, because this is why the education was subsidized in the very first place. What happened is there is no cost coverage for the higher education institutions, so there is a poor quality of graduate because you don't have enough tools. In addition, you have a lot of numbers. You have no financial barriers for entering the schools, and there is increase in the population. So a lot of students join the schools beyond the needs of the government, and you end up with excessive employment of physicians. We have an excess of employment of physicians. However, we have maldistribution as well, and that I will point up later. With these poor budgets and a high number of human resources, you will go down the salaries. You will not have enough resources to cover the salaries. People quit, the physicians are quitting to work in the curative sector instead of the primary health units because there they can have private practices and can provide themselves with enough income. And the physicians tend to select the specialty that will provide them with the best income, not the ones that are needed according to the health situation of the country. They focus usually on obs and obstetrics and gynecology, pediatrics and surgery. But if there are other needs, they're not interested, and the main interest of the government is increasing the primary health care. We need 90% of coverage primary health care, 10% of specialist and consultant care, but it's reversed in this situation. Another response that they started to use the public sector to refer the patients to their private practices, as like it's a market, it's where they find their patients, and that's why they're not interested in primary health care sector. They want to, primary health services, they need to work in the tertiary care. Refused their allocation, the rural health units, which was why they were actually given that free education. And there's poor allocation of physicians with great centralization of physicians in major urban areas and few physicians in the rural area. And that's why the average of productivity for physicians is 2 patients per hour. This is an average. However, when you go to central hospitals in main big cities like Cairo and Alexandria, we can examine like 180 patients per 2 hours. Whereas the health units in the rural centers, they have no patients at all because they all come to the tertiary care units where they think they will receive better care and attention. So there is a lot of misallocation because nothing was attended to since the 1960s in all the rules and regulations guiding. And there is an insurance of lifelong employment. You don't get fired in the Ministry of Health. You can get leaves, you can get a lot of stuff. There's a lot of backdoors to maintain your employment. So why are they maintaining their employment? Because it gives you the status with which you can start your private practice. Okay? So the first stage of the health sector reform in 1995 till the beginnings of the early 2000s focused, 1999 to be precise, was focusing on improving the fragmentation of the health system, creating the 3 tiers with the primary health care level, secondary and tertiary, and they started to invest in the infrastructure in the primary health care, creating a postgraduate training program in family medicine so that the first 2 years are invested in a rigorous, strong program like family medicine. And there was an international market for family medicine at that time starting all over the world. So it was something, from the point of view of physicians as well, it's a good opportunity. And they had improved incentives for primary health care physicians. This was all supported by major funds from major donors. So again, it is not a sustainable endeavor. Now, the second stage was to address the financial sustainability of system by creating better financial management and the human resource management. And this is when the problem started, because you need to change the regulations, change the system, shake the grounds that has been the tradition for a very long time, and the physicians has worked around that system for a while, so like you're changing their environments entirely and completely. So in 2005, as you remember, we had the first presidential elections, and he had in his program for his campaign is revamping the whole health sector, and actually they were pushing the second phase. But the second phase was not a new thing. It was part of the master plan that in 1995 started, but it was the time for launching it. With other sectors as well, we're undergoing a lot of economic liberalization strategies and stuff like that. I'm not from political background, so forgive me for if I use not very precise terms. And there was the cabinet that were formed at that time was dominated by people coming from the private sector, among which was the Minister of Health. Minister of Health, he happened to be a professor in the university. You're usually professors from the university, not from the Ministry of Health. The university is following the Ministry of Higher Education, not the Ministry of Health. And he is one of the major shareholders of one of the most expensive private hospitals in Egypt, Dar al-Fuad. It is the only accredited hospital by the JCO here in the United States. And so it's very expensive. So the plan was he will bring his private business experience and run the system to generate revenue rather than just losing money all the time. So the focus was, the major plans were privatization of some of the government hospitals, selling them out. Cost recovery and restructuring scheduled at public hospitals means that you will start to increase in co-payments. There will be fee schedules change. Pay for performance. The incentives are not given for all physicians. You need to perform better in order to secure your incentives. Relicensure, because we had the license for life. Once you graduated, you don't need to go to other tests to improve the quality. Removing the obligatory 2 years of appointment of young physicians. And this created a lot of turbulence, because now the physicians will find themselves on the street. They are not secured by this employment, the automatic employment they were looking forward for. And this started a lot of the turbulence. And creating a new residency program tailored to the need of the Ministry of Health, not to the physicians' wish. They don't just specialize in whatever sector they want. The attempts, as I was telling you, were not accepted by physicians. 50% of the physicians in Egypt are employed by the public health sector, and they saw this as selling out the government assets, laying off physicians instead of improving their circumstances, increasing the public, they are not addressing at all increasing the public spending issue. And there was no regulation in the private sector, because from the point of view of young physicians who has not yet had enough money to start their own private sector, the private sector was monopolized basically by the university professors. That's the truth. Because all university professors have private sector, and usually the highest fee schedules goes to university hospital, followed by consultants from the health insurance organization public sector. So it's in their own benefit that goes on that way, and there is a regulation that they should stay in their public work only, but you don't pay them well. So you cannot just tell them you stick to your job and leave the private sector unless you start to increase their salaries as well. So, and there was no reduction in the number of students in the medical schools, was not addressed in the policy at all. And still, the poor quality of undergraduate and postgraduate training, that was due to two reasons: the poor salary schedules for the university hospitals, as well the monopoly created by the university hospitals. Training more students means bringing competition into the private market. It's not in their favor to bring competition in the private market. It's ugly, I know. So the point is, the ministry staggered a lot in taking a lot of decisions, because any change in these bylaws need to be accepted by the People's Assembly. And they did not accept the reform bylaws or any drafts for new bills. They took a lot of time. At the same time, all the bills related to reforming the Constitution went just through the People's Assembly with majority of agreements. And at the same time, the Ministry of Health really have no influence at all on the Ministry of Higher Education. And so they were a major player in the game who was not involved and cannot be controlled at all in these reforms. The physicians started to demonstrate in 2007, specifically when they started to say there is no 2 years of obligatory. And they created a group called Doctors Without Rights, as like ironically, instead of Doctors Without Borders. They asked for better pay, increasing the budget of Ministry of Health, and decreasing the number of students accepted by the medical schools. These were the three main requests. They were joined later on by the medical syndicate, joined forces with the doctors' rights, and they were involved in negotiation efforts as representatives of physicians, although there were no elections run in the syndicate, which represents physicians for 20 years. But they were the negotiating party, okay? And they did not support going on strike at that time. Anyway, this was the story with a lot of sectors, and that culminated into the Egyptian Revolution. What happened after the Egyptian Revolution is the first election in the syndicate started since 20 years. And the syndicate has been controlled for years by the Brotherhood. So now a lot of the majority of Brotherhood lost seats to more independent people. However, the head of the syndicate still belongs to the Brotherhood, while the board of the syndicate is from independents. There were increase of salary schedules for employees of Ministry of Interior, policemen, for education. I'm not sure because this is from papers, but I don't have an authenticated source if the teachers, the school teachers, increased their salaries. And for higher education, I can confirm this. Because yes, when I went in the winter break, we had an increase in our basic salaries as higher education. In May 2012, they started their first strike to request an increase in their salaries. Then they waited after the presidential election. Nothing changed, so they went again on October 2012. And the movie I showed you, it was on November. It was after, because it went for several weeks. And then they were currently, last month, they were calling for another strike to, for their needs to be addressed. And it's in Arabic, but I would like you to show, because the nonverbal is very interesting. This is the representative of the Ministry of Finance, came with a response from the ministry after all these strikes of finance, not of health, and updating them with the decision they are taking in the reform of the bill. The bill, there were two bills, I think, but what I'm sure of, there was one by the independent parties, and there is one that is passed by the Ministry of Health. They did the whole form, and the physicians or the syndicate, they don't know what's the content of the bill to negotiate that. And there is like a group, there is a divide in the syndicate now, ones who are supporting the Brotherhood from, because that was a lot of majority of the Brotherhood, and the other independent groups. So the representative of the Ministry of Finance came to talk to the physicians of the syndicate. Some physicians don't just want to listen to him at all. He was saying he will leave. If they don't want to listen, he will just leave. He was saying that they are just conditional that the bill being accepted from the Shura Council, because we don't have a People Assembly now, they will prepare the necessary budget to improve the salaries. So they're asking him, when will you pass the bill? He was saying that there is a representative from the presidential office who is attending these negotiations. This is the first time that someone from the presidential bureau is attending such negotiations. He's begging them to hear, to listen to him. He was telling them next year. And immediately left, no discussion, nothing. Well, he's from the Ministry of Finance. He's not from the Ministry of Health. He's just representative of his higher authority. So as we can see, there is different drivers of this conflict. There are structural problems. One from the point of view of the government is the cost recovery problem. From the doctor's point of view, we need to increase the health budget, the human resources. Among other problems, there are the lifelong employment, the insured employment for life without how well you do. It is, we need better training. There is a lot of emotional dynamics, anger, lack of trust, frustration among physicians. There is different cognitions. The physicians see that the government is the problem, while the physicians see, the government see the physicians are the problem. And they reach the stalemate position where it's only increasing salaries and budget and not trying to address the underlying structural problems within the program. And the missing part is the poor coordination with other sectors like Ministry of Health, higher education, and the poor involvement of physicians in decision-making. Even the representative they're talking about that are attending the negotiation, we don't know if they are the majority from the Brotherhood, so it's the government from Brotherhood talking to a syndicate from the Brotherhood, and the physicians in between, they have nothing to say in the middle. So the situation polarized. From the government, physicians are hard to understand, just like their handwriting, and from the point of view of physicians, it's just another government that is trying to protect itself, or it's physicians and rights and health sector, like the presidential rhetoric now, don't mix. Okay, thank you very much. And I welcome your questions. Any questions? How depressed you are? Yes, please.
What's the tier of education for physicians, like high school, college, bachelor degree?
They start finishing high school and they have to graduate with a very high score. In our case, it's reaching 99 and 100% and 105% total score. So it's hard to deny students with 105% total like to attend a medical school. And then they go for training for 6 years, academia, and then they have the house officer year for 1 year. And now they increase the residency program from 3 years to 5 years. And under all these circumstances, they are subject to the very low pay of an average $50 per month. $50 per month for young physicians. That's the basic salary they're receiving. And that's the problem, because the basic salary is $50. You can get incentives, equal amount of incentive. What the physicians have been negotiating is to increase the basic salary from which you calculate the percentage of incentives. But as long as you are having the basic salary as low as $50 and you calculate as much incentives as you can do, how much will that amount to? Is it enough for him or her to lead a decent life, to support their own life? And this is the real problem in, that they are negotiating around. That's why they want to see the bill. Because the bill might come with increasing the incentives. They don't want that. They want the basic salary schedule to improve, even if it only improves to $100. But it will be like doubled. And then the incentives will be calculated from a higher scale. And that's what happens for the higher education, actually. They improved the basic salary. And that's what they're asking for.
Thank you, Aliaa, for your topic. In fact, I can relate to almost everything she said, and that's through my son. My eldest son is a doctor who graduated from Salaries University 2 years ago. And let me tell you, after the revolution, he has seen everything. Many times he and his colleagues were severely attacked by the relatives of the patients. And he said, that's too much for me. And he decided to go and work in another, from his point of view, better place, which is Sharm el-Sheikh, for 2 reasons. Because the salary is better, and the number of days to work is much less. And let me tell you about the surprise. After 2 months of working in Sharm el-Sheikh, his salary is reduced. So now you are asking about increasing the salary, and he told me instead of like $100 per month, it becomes like $80. although it's much farther from Cairo than any other place, and he decided to be on a take a leave and to study for his USMLE. So that's really very frustrating. After like 9 years of very hard work, he cannot have enough salary to make ends meet. And we support him in almost everything.
Okay, Alexander, then more.
Okay, I have two questions. The first question, how big is the health budget from the total budget of the country?
It's 4.7% GDP, but the 4.7% from the GDP, but 2.7% is public spending. 2.7% from the not from the total 4.7. It's like, you can say like it's less than 50% is public spending, and the rest of the pie is from the household out-of-pocket spending.
The second question is coming to the, like people say it and complain, that the salary is very small.
Mm-hmm.
So from your point of view, if the government will increase the salary, like let's say 4 times,
mm-hmm.
these doctors will start to serve better, the quality of the service will increase. Because like I saw, the infrastructure is deteriorated, so everything is like going down. Why I asking? Because I have example in my country. For example, in the past, the doctors also had like a small salary, and what was happening then the patients is coming to the doctor, they like ask the patients to pay additional money,
Okay.
and they like check a habit, and now the government increase the salary, so the doctor continue to do the same things. So they even they increase start to receive the more salary, they still continue to ask the people, okay, pay me some additional fee for your visit.
The under-table payment.
Exactly.
That
so
happens.
From your point of view, it will increase the quality of the service.
From my point of view, this is the problem. Physicians are simplifying the problem so much. They see it from only one direction, from their side of the story, when it's that complicated. Because when you come to the regulation side, like we really licensure program, and when you say that you can be fired if you're not performing well and all that stuff, when you start to tackle the regulatory part of the sector, they jump at you and just, no, improve our salaries first before you regulate us. So it doesn't work that way. The problem is it doesn't work by just miraculously improving the salary. And the whole system needs to be revamped, starting from the higher education, to tell you the truth. It has to start from the higher education, from my point of view. I don't know if this answers your question.
How did the salary of the doctor at the starting point compare with the salary which wages of the other streams?
Excuse me?
The salary of a young doctor, how does it compare with the salary of the other professions?
Other professions. When you see, like, for the public sector, for the Ministry of Interior, for instance, if you say the physician received 300 Egyptian pounds, okay, I'll take it, say it in the Egyptian pounds and then transform that into the dollar terms. When a fresh graduate from the law school, when employed in the DA office, in the Ministry of Interior, received 3,000 Egyptian pounds. And as a matter of fact, the School of Law takes very low percentage point to be admitted into it as compared to the medical who comes with 100% score. This is from the public sector point of view. When you look at schools like pharmacy, engineering, business administration, they go to the private sector. They don't go to the public sector usually, and they receive from 3,000 starting salary, from 3,000 to 6,000 starting salaries for fresh graduates.
Why do the brightest of your students who are having 100% and 105%, why are they opting for medicine?
Why they go for medicine? Because it's a cultural issue. This is the other part of because usually the idea of a physician, they had this khamsa ayn. If you get to become in the medical practice, you will secure yourself with a clinic, ayn عيادة, ayn عربية, car, عروسة, you'll get married quickly, ayn عربية, I said that, عزبة, you will have an estate, and عمارة, you will have a big, huge building as well. So this stayed in the back. That used to be the case when that first happened, when Gamal Abdel Nasser and all the early period when still we had leftovers from the monarchical period. Because when Egypt went to the 1952, it was the currency, the strength of the Egyptian currency was very high. I remember, I'm not accurate about that. It's what I know that it was the Egyptian pound was equivalent to the gold Egyptian, the gold, what is it? Guinea dahab. Yeah, the gold pound. So, and that was the thing that stuck into the minds of people, and so they encouraged people, and it was prestige, it was about all of us.
There's no change in the trend?
Currently it's showing some change. Currently, some change. Yes? I'm sorry, ma'am.
I'm wondering that why the reason of the doctors receive low salaries. Because, for example, in US and in Turkey, the doctors are among the top professions who receive the high salaries. Is this because of you said the socialist policies?
It's because the organizations are not covering their costs, actually. They're losing organization. They just, you just don't have cost recovery for anything. They're a poor fee schedule. You get service for free, but you use resources, you use consumables, you use a lot of things. You need revenue generation. But the cycle differs. Like if it's of a non-for-profit, you just don't distribute dividends. That's all. But you have to generate profit. But they don't run on the profit basis. They don't generate profit at all. This is one of the problems. The other point is the budget for the health sector has been ignored for a very long time. Very long time.
Yeah, for example, in Turkey, the health expenses is low, but the salaries of the doctors still high, even if the health expenses is low.
You have a huge number of physicians as well. You have a very huge number of physicians that you don't need, that you have to hire by law, even if you don't need them. So you don't have control in your input. There's a lot of poor regulation in the sector. Yes, ma'am.
Thank you for your very good presentation.
Thank you, ma'am.
Informing us about the medical situation of the welfare in this sector from Egypt. Because I was going to ask a question that.
I'm sorry, I
yes,
have a question.
about this interest that people have to study medicine despite the very low salaries. And you explain some kind of common aspiration, which is like some value that you have, because at the local level, if people, by studying medicine, they can get some prestigious, I don't know, at the local level that we find us being prestigious or something like that. So it means that there is a balance. Low salary, but you have some profits. So in terms of profit, I won't really criticize this low salary aspect, because I take my case, I'm from Côte d'Ivoire. When my first son got his baccalaureate, I was willing to see him studying medicine. But he was not willing to study medicine. He was willing to study finance and banking. And it is what he has chosen, because he told me, I don't want to be pharmacist, I don't want to be medicines, I want to be study finance, and it is what he did. But I'm aware that in Côte d'Ivoire we have the same problem. Low salary, despite more than 10 years of studies.
Exactly.
You know,
but after 10 years of study, when you start your private practice, life changes entirely.
Okay.
Entirely. But after a lot of time.
I guess part of the thing is that a lot of Egyptian, like graduates of medicine, they move to the other neighboring countries, okay, and they're very, like highly hired. So they get, jobs, even in the region where they, can get, like double time, like 10 times of what they're getting in Egypt, and even more. So they don't think only about, making a job maybe in the local market, but, they might go outside. We have a lot of Egyptian doctors in the market. Like, I would say like maybe 50% or 50%, of the doctors are Egyptian. So, yeah.
Thank you for raising that.
I have another question.
First of all, how many doctors are we talking about in total?
The total number of doctors now almost 200,000 physicians in the Ministry of Health. Okay. And we have an average of 6,000 physicians per year entering into the system. And you already cannot cover the cost for the 200,000, and you have to intake this 6,000 on yearly basis, on average.
The salary differential between the private sector and the public sector. Public sector, you say it's $50 a month?
Yeah.
What is it for the private sector?
It depends on your specialty level, on the private sector you're working in, and your background. So if you are coming from, you are a resident from the university hospital, still didn't earn your master degree, well, you're not in a very good position either way, and you will be, usually it's by the case. Usually you receive a total according to the number of case counts you treat. And you cannot sign any legal documents because it's against law that you serve at that time in the private sector. And so the private sector, you really push it hard on them. Like you can have from 10 to 20 per case, 20 pounds per case. So you will amount to a number of 300 to 500 Egyptian pounds. But once you earn your master degree, if you're in the public sector, you can start your own private clinic and start to run with a fee schedule from, if you're from public sector, you cannot go for more than 30 pounds per case. And it depends on where you open your clinic, the market stuff. But if you are in the university, it's not by law, it's by tradition, you don't start the your private practice unless you earn your PhD or the MD. Or else you will never earn the MD because you're allowed by your professor to join the market, okay? So at that time, you can start to charge money. You receive more from the private sector. You can go to up to 350 per visit for the patients. You can even charge more. It depends on the years of your experience, and actually the normal trend is that you find patients on the staircase of the private clinics because it's very crowded, and you sometimes for the major university hospital doctors, and not all the regions in Egypt. Again, you have to be located like in Alexandria, Cairo, the main big urban areas, and that's why the physicians like to locate themselves there, to brand themselves and give themselves a name in the market by this strong affiliation. And actually, because by time, when you are exposed to a lot of patients in these areas, you actually gain a lot of skills and expertise because you see a lot of cases. The case rate, you see very rare cases. And that's why when students go to other countries, that's like the United States, Canada as well, the problem is our program is not accredited, so they have to go through that pain again. But they have high proficiency because they have practiced in a lot of rare cases that is never seen. You don't need a lot of investigations because you don't have a lot of tools. You have high clinical sense. But it's by practicing on the patients. And that's an ethical issue.
So, you mentioned that almost the medical education that they get is almost free, $50.
Yeah.
So, did I understand this correctly? The government does not therefore tell the graduates of the medical school that you need to go and serve in this underserved, poor provinces of the country? They
do that, but the physicians don't go.
Why wouldn't the government hold something hostage until they do that? In other words, your accreditation until you have finished your year?
The graduation? They don't do that. Actually, we get the license after graduating immediately, so they cannot pull that string on them. What they have.
Make sense?
Yes, it doesn't. It doesn't make sense. I agree. It's like, they just take their post there and never show up. And that's why you have major hospitals. We have equipment in some, we have incubators in some hospitals in Upper Egypt, never touched. And you have a shortage up in Alexandria. 90 incubators serving 4 governorates. And these governorates like Matruh, it's a governorate that is like 5 hours from Alexandria. The hospital director, like when he gets one of the physicians, he never gives them a leave because he's not sure someone will come back. You know, it's like, this is the problem. And there's no law enforcement. This is the problem. There is no law enforcement in any sector in the public sector.
And in terms of the specialty of these medical doctors, again, the government has no set of requirement, guidelines as to, for example, we need more gynecologists and psychologists.
That's what they tried to do before the revolution, and there was a lot of problems when they tried to do that. The physicians won't accept that. They just want to specialize in whatever they want to. It's a wrong cultural tradition. Like, we played that game for so long that way. Now you are just disturbing the things, and it's a backlash. It was a backlash against restructuring. And I'm not saying that the governments are innocent and they're angels. No, they are not. Because actually, with the hospitals they were trying to sell out were to be replaced not by the private sector running them. They will be to be changed to malls and hotels. So what's the point if you're doing that? Yes, Mark, because...
So there are lots of parts to the problem. What's the piece that is most feasible politically and financially to fix? I mean, if you have to pick one place to start
yes.
that will have the most impact, what's the most feasible place?
I think the first thing is to really create a dialogue between the two parties. What you see there is that the top positions in the syndicates are actually either professors, either people from the private sector, either that way, and even if they are independent, some of them might be from other sectors. There is no like direct dialogue involving the physicians on one side, the ministry on one side, and the Ministry of Higher Education on the other side. The Ministry of Higher Education has to be part of this dialogue because they are monopolizing the private market. They are controlling the graduate studies by allowing people to, they fail sometimes people just to get a lot of professionals in that market. They need to create some flexibility in the public sector itself, like in the universities. If you resign, you cannot retake your position, ever. If you resign, it's a one way. You cannot reapply for a job. So you keep your job because this is what you know. But if I can just resign and reapply, if I get improved, it's okay. There's a lot of corruption in the medical education institution with a lot of inheritance among the siblings of the professors. So once you get to, that's why still people are attracted, because they're inheriting their father's estate, their father's business in medical practice. That's the truth. They just go in there and, you know, like my professors are friends of my father. So they get the scores and they get into the system. Why this happened? Because at the era of the 50s, now this law is canceled, but it built the culture. There was a 5% of siblings for professors in any faculty who are just by the virtue of being the son or daughter of a professor, you have the right to be hired in one of the higher education institutions despite the total, despite that you come lower in rank. This was removed later on, but it left there the culture. And it became like an inheritance. And if you are, you know, like the fight is, you get there, you don't have your back protected by any of the professors. Oh my God, you made it. You must be excellent. Okay, you are our son now. Okay? You had the mark of fire. you prevailed. So this is a big issue. And this creates a lot of frustration. And sometimes the funny thing is a lot of people who suffered this redo it. Because that happened to us. This is justifiable enough that we can do the same thing. But now, lucky us that the children or the siblings of the professor are not interested anymore. They are not interested that much in going to medical schools anymore because there are other flourishing businesses now, unfortunately. Any more questions? Yes?
My name is Gawad Nabulsi. I've been involved in the medical field now maybe 2 years. We were doing the revolution I wanted to take your opinion about a certain issue that it was new to me, it's coming from the outside of the medical field. There was a medical center in our area. We work in Masjid Nasser. It's been closed for 5 years.
Closed?
For 5 years.
Okay.
So it's the only medical center that caters to like 1 million people. So we got funding, and we wanted to open the center. That was 2 years ago. And we've been fighting for 2 years. You know, hopefully now we will sign the contract. But there was 2 years of constant struggle with the government and a lot of the doctors. Is that this has never been said before, that a private institution or a non-profit organization can put their hands on a wahda sahiyya, I don't know what they call it, and actually run it, even for non-for-profit. They said this does not happen, and this is something that we don't want to allow. And there is no law actually that was done for private partnership in the medical field. And I'm just wondering, are you one of the people who are supportive and of such an action that not leave to the government, privatize it, even on a non-for-profit or for a private company?
The funny thing about what you're saying is the model you're talking about is being operated and tested as a pilot study in Alexandria, where 10... it's not for Alexandria University. The family health model in Alexandria, which is a pilot project, has been running, and I have a study that tested that model in specific, the performance of non-profit sector in running the family health units instead of the government. In addition, there is a unit in the Ministry of Health that was created by Hatem El-Gabali just before the revolution by one of the graduates of Boston Masters of Business Administration, and I know the person personally. His appointment was to the public-private partnership unit to work on that issue specific. So this is the problem. You don't have documents. You don't have communication between units. There is nothing. You don't have the real. If you ask them for the paper to give you the law that writes this or where is the documentation, you won't know. They don't know where it is. Okay? So you need to dig for that stuff. If you bring evidence from Alexandria, they will start to listen to you. People after the revolution are scared to do anything.
They don't want to sign a paper.
They are scared because they don't know what will happen in the next moment. So if it's after the revolution, I understand their fear. Yeah. But if you want to nudge it, go. Okay, you can. My contacts. I will give you my contacts now.
All right. And I'm afraid we might have to wrap it.
Let's.
Make it quick. Yeah.
Okay.
I'm trying to keep track of time.
Do you have a statistic? How many % of the population are served by private doctors, private companies?
For the ambulatory care, the rough estimate, which is by the Ministry, by the World Health Organization, it's from 60 to 70% in ambulatory care. In the inpatients, it increases in the public sector to cover 50, or sometimes it's 50% almost, because the health insurance organization provide good inpatient care, but it's usually going for people who work in the formal sectors, who are employees, and ignores the low-income people who are in formal sector and not part of the health insurance organization.
Okay, thank you very much.